Dr. Nina, nice to meet you. Hi. I'm not going to use your name because we are doing a recording today, and this is Mikey D'Angelo, and she'll be recording for me. And the purpose of this is for me to conduct a case history, ask you the usual questions, and Mikey is going ahead and type it into the computer. So I'm going to be instructing her what to type in.
Yeah.
And we're going to go slowly so she can get everything important in the computer. So there'll be times I may be slowing down and waiting for her to type the information in, but I'm going to direct her.
Okay.
Okay? Yeah. Nice to have you here, and I know you've been here a couple more times. Glad to see you again.
Thank you.
How old are you?
32.
32 years old, okay. And what's the reason for the visit today?
Yearly visit, but then kind of getting headaches on eye heating, so.
Okay. Where do you get the headaches?
Like in the head, forehead, and around the eyes.
Okay, so the headaches are on the forehead and around the eyes. Now, are they worse any particular times or when you're doing any particular task?
I think when it's hot.
When it's hot.
Yeah.
The headaches are mostly when it's hot out. Are they associated with any visual task, like reading or watching TV? Or
I think the glare from the lights and from the sun. No.
From the sun?
Yeah.
Okay. So it's not really so much involved with using your eyes to see, it's more associated with the glare from the sun when it's hot out.
Yes.
Okay. Do sunglasses help these headaches?
Yeah.
Okay. They do.
I guess so.
Okay. And just tell me, is this something new or is this something you've had for a long time?
I think it's new because it started hitting more, and like from time to time when I come outside, it will hurt like more now than before.
Okay. So it's been happening for a while,
Yeah.
but it's more so recently. Okay. So we have that she's been having headaches. It's more so when she's out in the sun, when it's hot, it's around her forehead. You've been getting them for a while, but there's more recently. Okay. So we got that in the history of personalities. Great. Now, are you having any other problems with your eyes in terms of your vision? Are you seeing okay?
Yeah. Yes.
You are?
Far,
Okay.
No.
Not too good at seeing far?
No.
Okay. Do you wear glasses?
Yeah, but I don't have them today.
You don't have them. You have them, but you didn't bring them with you.
No.
Okay. Do they help your vision when you're seeing, when you're using them?
Yeah.
No? How come you don't use them?
Sometimes, well, I don't, the prescription that I use now, it's not up to date with the last one, so I never get time to fill the last one, which is not good. Because the prescription in the last one changed from the one before.
Okay.
Yeah.
So in additional history at this point, all we want is DV blur,
Yep.
okay, using old glasses,
Yep.
and that's it. Okay. I'm just going to list a few other symptoms here, and you tell me if any of these things are bothering you. I'm going to give you a list, okay? Flashing lights, floating spots, flashing, long time or recent?
I guess recent.
Recent?
Yeah.
When do they occur?
You know, most of the time I like to lie in the dark.
Okay.
And then like if I come outside or if I do light turn on, light like when it's flashing, it affects
So when you
my
go
eyes.
from the dark to the light?
Yeah,
Okay.
that's one.
Okay. Well, I don't think that's significant. I would
Yeah.
just put flashes when it goes from dark to light. That's about it. I don't think that's all that much to worry
Alright.
about. Any severe tearing, severe burning, severe itching, severe redness?
No,
Nothing. Okay, double vision. You ever see two of anything?
not that often.
Not that often. Okay. All right. Rare double vision. Okay. It's not a particular problem for you when
No.
you see this. Okay. All right.
When that happened,
Uh-huh.
normally I would close my eyes and like rub it.
Love it.
And
And
then,
goes away.
yeah.
Okay. It's been happening for a while.
Yeah.
long-standing double vision, rare, improves when closes eyes.
Yeah.
Right? Okay. Okay, let me ask you a little bit about your eye history. Now, I was reviewing your chart, and it says that in the right eye, your vision is a little worse than the left eye.
Yeah.
You're aware of that,
Yeah.
right? Has it always been like that, or is that something new?
I think it always been
It's
like
always
that.
been that way. The word they used for it was amblyopia, what's sometimes called lazy eye.
Yeah.
Did you ever hear that term before? No. Okay.
I did, but not with me because I know the last time they said I have more stigmatism in one eye than the other,
Correct.
and I have to keep on glasses. So.
Okay. So this is in the PMH part of the chart here, which is really the ocular history, and it should say mild amblyopia, OD, BVA 2025. Are we there? Should I slow down? Okay. So basically, your vision, what I'm telling you is your vision's been reduced in the right eye for a long time, a little bit.
Yeah.
And as you say, it's associated with the astigmatism.
Yeah.
Okay. Now, aside from that, I'm going to ask you a little more about the rest of your ocular history. Any bad injuries to your eyes, bad infections, diseases,
No.
nothing else. So we'll free text no other significant ocular history. Okay. Let's talk about your family ocular history. I noticed on the form here, you checked off you have a family history of glaucoma.
Yeah.
Yeah. Who has glaucoma?
My grandmother.
Grandmother?
Mhm.
Mother's side or
Yes,
father's?
mother.
Mother's. And you're sure it's glaucoma? It's not cataracts or anything like that?
No.
Glaucoma.
Yeah.
Okay. Did she lose vision from it? Do you know? Did
Is
she go
she?
blind or?
She not as blind as, you know, but she
lost some
yeah.
vision from it.
Yeah.
Okay.
On the both side because mother and father both wear eyeglasses.
Glasses? Okay.
Yeah. Yeah, both mother and father.
Museum. So your mother and father wear glasses?
Yeah.
But they don't have glaucoma?
No,
Okay.
but
Just
they can't see without the glasses.
Gotcha, okay. So grandmother, I think the only really significant thing in that history is your grandmother has glaucoma and
Yeah.
she doesn't see very well.
Yeah.
Okay. Let me ask you about your general health history over here. Do you have any general medical problems at all?
No.
Nothing. No high blood pressure, diabetes. We should be in the review of systems here. Great, she's there. Bad skin conditions, heart conditions, neurological conditions, psychological. Everything is now great.
Yeah.
Okay. Do you take any medications?
No.
No meds. Okay, this is going to be very easy. Do you have any allergies?
No.
No allergies.
Allergies to what? Medication?
Either one. Let's stay
Probably-
medication first. Anything
No.
for medication?
No. Not to medication, but to outside sometimes, yes.
Like airborne,
Yeah.
pollen
Yeah.
kind of thing?
The eyes itches
All right.
yeah, but
So
no
let's say
allergies.
airborne allergies.
Yeah. If the pollen outside is high,
Yes,
my eye would water and it would itch a lot.
Okay.
So
very
yes,
common.
yeah.
Do you use any eye drops for that?
No.
Okay, I would put that she does not use allergic to pollen, does not use eye drops. Couple other questions I want to ask you, which actually belong in another part of the chart. Your last eye exam, which is in the additional symptoms. Was it here?
Yeah.
The last eye examination?
Last year.
2010.
Yeah.
Okay, great. And you weren't seen any place else since then?
No.
So
No.
your last medical exam was? General physical at the doctor.
Last year.
Last 2010?
Yeah.
Okay. Alrighty. So what type of work do you do?
I'm a nanny.
You're a nanny?
Yeah.
Okay, alright. How do you use your eyes during the day? This should be in personal history. Okay. Do you do a lot of reading with the kids?
I use the computer a lot.
Using the computer.
Yeah.
Okay, so in personal history, computer
Like
use.
most of the day I sit on the computer. Then I be outside.
How old are the kids?
They older. One is 13 or one is 14.
So they teach you how to use a computer?
No, I could use a computer.
Okay, yeah, I'm saying they're probably pretty good with your computers.
Yeah,
at that
they're
age.
really good.
Just a couple of lifestyle questions I want to ask that
All
can
right.
affect the eyes. Do you smoke?
No,
Use alcohol?
no.
No. So that's a negative. Okay. Anything else, Mikey, that we should cover in the history?
Surgery.
Surgery, yes. And I think you put something here
Yes,
about the
I
surgery.
did.
What kind of surgery did you
At colorectal and breast, a mass removal.
Mass removed from the breast, benign?
Yeah. Yes,
mass?
yes.
When was that?
Probably like,
Approximately.
yeah, about 5 years ago.
Okay. Which breast? Right one? Okay. Yeah.
Oh, yeah.
I'll take your word for it. Thank
No,
you.
you know what, I'm looking for this scar because I have a scar on it, so, yeah.
Okay.
You're right.
You got that?
Yeah.
Okay. And the colorectal, what was that? Was that polyps removed?
Yeah,
Okay. And when was that?
about, yeah, same time.
About 5 years
Yeah,
ago?
yeah.
Okay. Is there anything, are you interested in contacts as well?
Yes, I don't mind, yeah.
Okay.
But I'm afraid of it though.
All right, so we can give you some information about that as we go along.
All right.
You're inquiring, you're asking about contacts, and
Yeah.
we'll tell you from there.
All right.
You've never tried contacts
No.
before, right? Okay, after we do the exam, get all the results.
Is it good for me or
It
no?
might be, but.
Because of my
let's-
eye problem?
Well, some people with your eye problem can wear contacts successfully. The answer is yes in some cases, but we'll have to get all the results in,
Yeah.
and then we'll go over the whole picture, and then we'll let you know once we get all the results.
Okay,
Okay?
yeah.
So, you told me about your headaches, you told me about the problem seeing far away
Yeah.
with the old glasses.
Yeah.
Is there anything else that you want to tell me, anything else we should pay attention to that we haven't covered yet?
Oh, no. No, that's all.
Okay,
Yeah.
great. Okay. Thank you very much. Mikey, when you're ready, do you want to summarize what you've written here for a nice patient? And she can hear it back. We'll give her a minute. Are you off today from work?
Yeah.
Oh, you're off?
Oh, yeah.
Okay.
They sleepaway camp. One in Vietnam on a team tour, and the other one is
The sleepaway camp, so do you work during the summer? When they're
Yeah,
in
2
town
days.
as well? Oh, 2 days?
2 days, yeah.
Okay.
Monday and Friday.
Oh, because they're in heat, they're around.
Yeah.
Oh, that's nice. All right, Mikey's ready. Let's see how we did.
We have a 32-year-old black female, and she's coming in complaining of reduced vision with her distance vision glasses from 2 exams ago. She's currently, with her glasses, she's not wearing them right now, but she does have them and she does wear them. She also came in complaining of a headache on her forehead, around her eyes as well. And she finds that this headache comes when it's hot out and it's associated with the glare from the sun. But she finds some relief with some sunglasses. She said that this has been going on for a while, but she has noticed a little bit of an increase in severity of recent. She also noted that she has some flashing lights when she goes from dark to light, and some long-standing double vision, but she said it's rare, but it improves when she rubs her eyes. She didn't complain of any floaters, any redness, burning, itching, but she is allergic to pollen, and her last medical exam was in 2010, and from that, she has no permanent medical symptoms, and she does have a history of refractive amblyopia in her right eye with the best corrected vision at 20/25. She doesn't have any history of any injury, anything really other than that amblyopia in her eye. And she did have colorectal polyps removed and a benign mass removed from her right breast about 5 years ago. And she's a nanny who doesn't smoke or use alcohol, but she does use a computer frequently. And that's about it so far. And also that she does have a glaucoma history in her family. And so we're just going to make sure, take a look at that for her just to make sure everything's good, and she's not currently on any medications.
Great, and she's interested in hearing about contacts, and we'll discuss that after the results of the exam.
Okay.
Okay, did we cover everything?
Yes.
Okay. Thank you very much.
You're
It's a
welcome.
pleasure meeting you.
You too.
Thank Thank you.